The Yobe State healthcare sector, powered by a reform-minded governor, Honorable Mai Malabuni CON, has for the past 3 years been subjected to a reform process to provide a realistic and substantially make the health needs of the growing state in line with the vision of the reform. The holistic approach has changed the face of healthcare delivery system in Yobe State. Because of Governor Mai Malabuni's administration is indeed another signature success that surpassed all previous records in the state since its creation. The primary healthcare subsector represents the rapidly changing face of healthcare delivery in the state, concretizing commitment and reflecting the overwhelming successes of Honorable Mai Malabuni's administration towards strengthening and sustaining inclusive and efficient healthcare coverage which his government pledged to the people ab initio. Buni's drive towards transforming healthcare delivery in the state is occasioned by huge investment in infrastructure, equipment, and human resources, leading to the construction of comprehensive and functional primary healthcare centers, one each in the 178 wards of the state. A true testimony of healthcare delivery system right at the doorstep of the masses that need it most. That spurred up massive construction and reforms in the entire sector.
Health is wealth. Therefore, it is even an understatement to say that it is essential. It is very, very essential. And that's the reason why we embark upon that. Also to bring the healthcare delivery to the doorstep of our people at the grassroots level. So alhamdulillah, we are able to achieve that.
Gabai Village is one of the beneficiaries of the One Political Ward, One Primary Healthcare Center program of the Buni administration. The facility has a large reception, a male and female medical ward, a pharmacy, an equipped laboratory, a labor room with the prerequisite equipment for taking deliveries. Others are a family planning unit, a borehole, an extended running taps, as well as staff quarters secured with a perimeter fence. Similar structures are obtained in all the 138 completed and fully operational healthcare centers in 138 of the proposed 178 political wards, with 40 others ongoing. Aisha Bulama came to the facility for medical consulting and treatment. She is happy with the services she receives.
Yanzu samun mu wannan asibitin a gaskiya mun yi murna sosai saboda yanzu wannan asibitin tun da aka same shi muna samun ayyukan, muna zuwa asibiti tun daga safe har dare. In ka zo za ka samu ma'aikaci ko da suna gida ne, in ka je ka buga musu kofa za su zo su duba ka saboda muna samu suna kwana nan. A gaskiya yanzu mun fi jin daɗin asibitin nan saboda yanzu kuma akwai isasshen ma'aikata. Ma'aikata ba sa yankewa sannan aiki ko yaushe ka zo za a maka, ko mun dare ka zo ka buga kofa za a tashi a maka aiki. A gaskiya mu yanzu mun fi jin daɗin asibitin nan.
Meanwhile, the facility manager, Mr. Musa Abubakar, says hospital attendance is improving considerably, especially now that there are staff, drugs, a laboratory, male and female wards for admission, and antenatal and postnatal services to expectant and nursing mothers.
So we have about 127, but recently they still come and enroll some, about 59 people. Due to the fact that in this ward we have two facilities in this ward. That's what reduced the numbers of the enrollment. If not because of that, we have supposed to get about 130 people that we enroll on live as a board. Because of that, they divide it. They take the half to the another facility that is Kalalawa.
In communities along Nigeria-Niger Republic border, the residents have begun to enjoy services from these facilities. Only recently, the Commissioner of Health, Dr. Mohammed Lawan Ghana, accompanied by top officials of the ministry, commissioned some of the centers in the depth of encroaching dunes in northern Yobe.
This ward called Alanjurori Ward is a ward that is located along the border of Yusufari local government, which is in Yobe State. Just about 3 years ago, the people of this community had to travel as far as Niger Republic in order to access healthcare services. And this was very unacceptable. And as a result of this, His Excellency constructed this brand new facility for this ward. It is not only construction of a facility, but in addition to it, it is backed by the necessary equipment, by the human resource, with the medicines, and then of course there is also a healthcare financing mechanism under the Equity Fund program and the Basic Healthcare Provision Fund.
For these communities, the new facilities have created a huge impact by providing easy access to facilities, subsidized healthcare and quality services, putting an end to the tiresome hurdle of trekking through the sand dunes to cross over to Nigeria-Niger border to access healthcare services in Niger Republic. It is now history. The Buni administration has brought functional healthcare services to the doorsteps of the people.
Mun kasance muna shan wahala da dalilin rashin lafiya. Muna shan wahala sosai, wahala ta wanda ba zai ma fito ba. Kamar yadda mai girma kwamishina ya ce, mafi yawan muna zuwa Niger. A matsayin mu na 'yan Najeriya muna neman tallafi daga hannun 'yan Niger suna tallafa mana. Yau ina ganin Allah ya kawo mana karshen wannan mun gode wa Allah.
The State Commissioner of Health believes that the 178 primary health centers not only fulfill the campaign promise of the governor, but keys into the strategic plan of Buni's vision of a comprehensive and all-inclusive health coverage at the basic level of care.
There is no intervention that will take place without the involvement of the traditional institutions. This is in view of the need to have comprehensive primary healthcare systems, because primary healthcare is all about providing access to the people with the right technology to the people, but with the involvement of the people. And this is exactly what the government of His Excellency has done.
Additionally, the Buni administration has, at the secondary level of healthcare delivery, taken the daring step of increasing the number of specialist hospitals to complement the 2.5-decade-old Damatru Specialist Hospital that was stretched and too far for some referral patients coming from other parts of the state. The administration has rejigged and promoted 4 more facilities to specialist status, one each from the 3 senatorial zones of the state, to guarantee fair spread and easy access. The new specialist hospitals are located in Buni Yadi, Gashua, Jaidam, and Potiskum. Each facility received structural overhaul, supplies of standard medical equipment, reagents, and drugs, as well as medical staff, including consultants, in conformity with the standards befitting of specialist hospitals. To deepen and strengthen the sectoral reforms to improve access and achieve inclusion in the delivery of healthcare, 6 additional facilities were upgraded from comprehensive healthcare centers to general hospital. They include Bara, Babangida, Jaji-Maji, Machina, Yunusari, and Yusufari. Mindful of the huge challenge healthcare human resource pose for successful delivery of effective and efficient healthcare in the state, the Buni administration invested tremendously in state-owned health institutions in a bid to produce qualified nurses, midwives, and health technicians to fill the personnel gap in its facilities. Amazed by the unprecedented developments in the sector, Dr. Hamis Sume Musa, Provost of Galadima Mekari College of Health Science and Technology Nguru, describes the ongoing progress in the health sector as a revolution that is transforming healthcare delivery in the state.
When Memala Buni come on board, it is being said that there is a state of emergency in education. I know it's a state on education, but we have seen it in the health sector. Whoever comes to the state now knows that the health sector has been reformed. Look at what happened to primary care facilities. They were upgraded to secondary, some of them even to tertiary. Nowhere you go now in Yobe State without health facilities.
The college snowballed from only 2 accredited courses to achieving 10 additional courses, a feat it accomplished from 2019 to 2021. This comes through the support the institution receives from the Buni administration and staffing. The laboratories and ICT centers are cardinal to teaching and research and was adequately equipped. They include a medical health lab, community health lab, pharmacy, public health lab, medical records, and a 100-man capacity information technology center, respectively.
Within a short period of time, we started doing degree programs in many courses in the college. And I'm sure with if this support by the government continues like this, we'll do more than degree in this school.
Likewise, Sheikh Husuli College of Nursing and Midwifery has never had it this good, as the college also enjoys great patronage from the Buni administration, especially in infrastructural development. The Buni government constructed a library of international standard at the college and expanding the administrative block and network of access roads and drains. In addition, 2 blocks of 1-story classrooms and 3 blocks of 1-story hostel accommodation were built.
This institution have witnessed a robust intervention, both in terms of human and non-human infrastructure. Let me talk about the issue of infrastructure. When we assumed office, virtually this institution was battling with very few infrastructures, particularly hostel accommodation and classes. And we all know that this will determine the type of accreditation you will be granted from the regulatory body. So this administration from 2019, when His Excellency visited this institution, let me quote you to say that he was the first sitting governor to visit the institution, to sit down and attend a program, a graduation ceremony. We laid our complaint and he listened to us, and there and then he granted approval. First and foremost, the construction of the 1 and ever story building. This is the only story building we have in the institution, which is holding about 200 bed capacity.
The combined support of the state government and the dedication of the college authority have in the past 3 years resulted in 100% success in students' final examinations. And this year, the college got the council's nod to commence higher national diploma in nursing and midwifery. Lecturers are also sponsored by the government to further their education. The regime also places student doctors, nurses, and midwives on a monthly stipend to encourage them in their studies. The government provided automatic employment to over 300 graduates of the College of Nursing and Midwifery and 172 graduates of the College of Health Science and Technology.
We are now giving employments, giving support, and at the same time sponsoring students, especially from the difficult areas where we established those primary health centers. We used to give employment to students who are from that community, for them to be properly trained to go and man also the primary health centers, which is also yielding a positive result.
What His Excellency has also done is also to provide the necessary equipment. So the facilities have also been equipped, and then also the manpower that are needed to provide the services. As it is, His Excellency has employed, in the last 3 years, he has employed over 500 nurses and midwives across the system. In addition to that, he has also employed pharmacy technicians, lab technicians, medical records professionals, and all amounting to about 100 and I think about 172 or so. So all of them were actually employed, and then they were deployed across the system to provide those services. The idea is to establish primary healthcare systems across there.
Aisha Mohammed Idris, a medical record technician, and Adamu Mohammed Kabir, a pharmacy technician, graduated from Galadima Meikiari College of Health Sciences and Technology in Nguru, and benefited from the recent employment exercise and deployed to their alma mater, expressed their happiness and appreciation to the Governor Buni's kind gesture.
We graduated and we got an employment from our Governor Memala Buni. We thank him so much and we pray for him for that employment.
We graduated successfully, and Alhamdulillah, we have been employed into this college for us to keep on delivering our services toward our junior ones for them to transform into an area that they will be good in whatever places they find themselves.
One lingering question in the hearts and minds of the people is the fear of sustainability of the massive development and investment in the health sector in the face of dwindling revenues accruing to the state. Dr. Mohammed Lawan Ghana and the Executive Secretary of Yobe State Contributory Health Management Agency says the answer is not far-fetched, as the Buni administration has evolved measures to ensure sustainability in the programs introduced by the state government.
The only sustainable and continuous means of funding of all our healthcare facilities in the state is this Yobe State Contributory Healthcare Management Agency. Because at the end of every month, there's what we call capitation, which is a prepayment to all the healthcare, to all our engaged healthcare facilities. And these healthcare facilities are using this, whether an individual goes to access care or not, we, at the end of the month, it's mandatory for us to pay this capitation to all the healthcare providers. And this amount they are getting is bridging the fiscal space or the fiscal gap in all the healthcare facilities in the state. So they are using such funds in their facility to purchase quality drugs, employ quality and technical and qualified manpower to bridge the manpower gap in the respective healthcare facilities. So I think the only sustainable means of funding as far as the state is concerned is this Yobe State Contributory Healthcare Management Agency.
The role of Yobe State Contributory Health Management Agency and Yobe State Drug Management Agency do not only provide drug availability, but also guarantee sustainable healthcare financing. Presently, health facilities across the state generate revenue that enables them to provide services and maintain the facilities. Meanwhile, at the tertiary level of care, the Buni administration has dazzlingly improved the quality of services at the University Teaching Hospital. The upgrade of biomedical equipment for diagnosis such as the MRI, the CT scan machines, as well as the digital X-ray, mammography, and the ultrasound scan machines are all state-of-the-art. In addition, images and information generated by these machines are stored in a central server with a 10 terabyte capacity at the Electronic Health Record and Picture Archival Communication System Unit. Physicians will access patients' information and images from their computers in the comfort of their offices and on demand could send them to any hospital in any part of the world. In short, the teaching hospital has instituted a paperless regime that can be accessed from any part of the universe.
Initially there were a lot of resistance, but people are now happy with it. It has made life easier for them. Sometimes even in the comfort of your room, you will be able to know. And then there is also a financial and administrative aspect of the software that have been attached. So we will know also how much the charges you do in the hospital, what are you making in a day in the revolving fund. At the same time, also auditors they have windows in which they can log in to see what is happening. So there are a lot of advantage compared to what we've been doing before.
At the Electrocardiography Center, Hussein Iraji, a clinical physiologist, gives a rundown on the machines and other equipment, including training facilities. Also, the theater complex houses 4 operational suites with sophisticated theater equipment ranging from microscopes, endoscopies, mobile X-ray machines, and diatoms, among others.
We must commend the state government under the able leadership of His Excellency Honorable Malabuni, CON, for taking the standard of the hospital to this level. If you look at our hospital, one can beat his chest and proudly say that there is none of its type in the whole of the region, that's the northeastern part of Nigeria, in terms of equipment. If you look at radio diagnostic, we have state-of-the-art 1.5 Tesla MRI machine. We have a 164 slide CT scanner with other facilities that you can do cardiac scanning, you can do coronary angio, renal angio, peripheral angio. These are all specialized studies that you can do to study blood vessels in the body and organs in the body. We also have facilities like a digital X-ray, 3D ultrasound machine, and so on, courtesy of the government of His Excellency. At the same time, our laboratory is also equipped with fully automated state-of-the-art equipment. Same thing with the theater and so on.
Similarly, the dialysis center is equipped with advanced gadgets and machines that provide dialysis services to Yobe State indigents free of charge. The Buni government has also constructed one-story building comprising 32 self-contained rooms for doctors' internships.
The government has trained so many doctors. We saw the need to also further expand the internship quota of the state. So as such, that of the teaching hospital, we started with the house officers' quarters, because this is just one of the things that is remaining. All the remaining requirements have been met. So very soon we're going to invite the Medical and Dental Council to come and do to give us accreditation to commence the internship. So for now we are doing the two, but in the future we're also looking at a situation where the other specialist hospitals can also start internship.
These phenomenal strides that Governor Buni took despite the lean resources coming to the state are but a glimpse of the governor's daring transformative vision of the state's healthcare sector. Buni is putting a final touch to the country's largest maternity, pediatrics, and newborn complex constructed at the Yobe State University Teaching Hospital in Damaturu. The 7 blocks, 1-story structural complex has adequate spaces that are most patient-friendly, conducive, and in keeping with the evidence-based global best practice in modern maternal, newborn, and pediatric healthcare as found in advanced countries of the world. This architectural masterpiece will adequately and indeed satisfactorily take care of expectant and nursing mothers, their newborn babies, as well as children in general. The obstetrics and gynecology wing of the complex has 64 open cubicles, 5 call duty rooms, 5 satellite pharmacies, 1 side laboratory, and 4 nursing stations. The special baby care unit has 3 adjoining generously spacious and nicely done wards that include 28 baby cot wards for newborn babies suspected of sepsis, 10 newborn cot wards for outborn babies, and 10 newborn baby cot wards for inborn babies, 4 nursing stations, 10 bed space room or unit for their nursing mothers. In addition, there is a 10-bed space room for nursing mothers to breastfeed their newborn babies, 5 doctors' rest or call duty rooms, 5 nurses' rest or change rooms, 5 offices for the unit matron in charge, 4 additional offices for health information management and documentation, seminar room, a library with kitchen and stores. The labor ward and obstetrics theater units have provision for 4 operation suite rooms, including attached sterilization and scrubbing area, 6 recovery rooms, additional offices for anesthetics, perioperative nurses, other theater support staff, male and female change rooms, common room for staff on duty, seminar and computer rooms. The pediatric medical ward has 40 cubicles, 4 call rooms, 4 side labs, and satellite pharmacies. Similarly, the emergency pediatric unit has 32 bed space cubicles, including a resuscitation cubicle, 2 doctors' call duty rooms, a side laboratory, a nurse's station, a change room, a satellite pharmacy, and 8 staff offices. The complex is being equipped with state-of-the-art machines to provide all the necessary healthcare services to mother and child to effectively curb the menace of maternal and child mortality in the state. There is no doubt that this ambitious project, which is about to be commissioned, will be the largest maternal, newborn, and child healthcare complex in Nigeria. Beyond providing access to healthcare facilities, subsidizing healthcare, and ensuring inclusion in healthcare coverage, Buni's vision is to put a stop to the unacceptable rate of maternal and under 5 children mortality in the state. The mouth-watering subsidies in the administration of healthcare offered by the Yobe State government are attracting medical tourists to the state. To Elijah Adamu Hashiru, a retired permanent secretary from Bauchi State who was to travel to Egypt to seek medical service to his ailing child but was referred by his neighbor to go to Yobe State Teaching Hospital. The services provided by the institution was truly revolutionary. After 2 successful surgery operations, the retired permanent secretary could not hide his joy that he obtained the required services at the Yobe Teaching Hospital at a very minimal cost compared to what would have cost him if he had traveled to Egypt. He was full of gratitude to the Yobe State government for investing in the health sector and providing the needed services to the people. He called on all the state governments to emulate Governor Buni's revolution in the health sector.
Wani abun farin ciki da na ji a wannan asibitin shine dialysis da kuke wa mutane is free. Har ina cewa ko kudin kati ba a karba, aka ce hatta paracetamol in kana da zazzabi kana kan gadon dialysis free za a maka. To gaskiya wannan gwamnati ce mai adalci, kuma muna addu'a yadda wannan gwamnan yake yi, Allah ubangiji ya sa sauran gwamnoni na wannan shiya su ma su yi copyright da abinda wannan gwamna yake wa talakawansa.
As for Yobe indigents, hundreds of thousands of children under 5 years, the elderly, and vulnerable persons are enjoying free medical services such as the Free Drug Program, Social Equity and Basic Healthcare Scheme Program under the Yobe State Contributory Health Scheme introduced by Governor Mai Balabuni. The excellent healthcare services provided by the Yobe State government at almost no cost have made healthcare delivery in the state very amazing, affordable, and accessible. Surely, Buni is working and Yobe State is moving to the glory of the Almighty.